Can a skin biopsy cause bleeding or infection? Have you ever wondered if a skin biopsy could lead to complications like bleeding or infection? The short answer is yes, a skin biopsy can cause both, but these issues are generally uncommon and manageable with the right care. Bleeding is the most frequent immediate complication after a skin biopsy. This can happen at the site of the biopsy, especially in areas rich in blood vessels, such as the scalp, face, or nails. If you experience minor bleeding or oozing right after the procedure, that is usually normal. Applying direct pressure for about 10 to 20 minutes typically helps stop the bleeding. However, if the biopsy site is on an extremity, or if you are taking blood-thinning medications, you might notice more significant bleeding that could requiring medical attention. Infection is a possible delayed complication following a skin biopsy. Signs that you may have an infection include increased redness, swelling, warmth, pain, pus or drainage, and sometimes even fever. Certain areas of the body, like skin folds, armpits, groin, and lower legs, are more susceptible to infections. Factors that can increase the risk of infection include having a weakened immune system, diabetes, using unsterile instruments, not caring for the wound properly, or not receiving antibiotics when necessary. The most common bacteria involved in these infections is Staphylococcus aureus, which can include resistant strains. Other complications related to the biopsy site can include wound dehiscence, which is when the wound reopens, scarring that can vary in appearance, and allergic reactions to antiseptics or local anesthetics used during the procedure. To reduce the risks of complications, it is crucial to follow proper sterile techniques during the biopsy and to care for the wound appropriately afterward. Monitoring for any signs of bleeding or infection is also essential. Always follow your healthcare provider's instructions closely and do not hesitate to seek medical advice if you notice uncontrolled bleeding, signs of infection, or ongoing pain. In the context of skin cancer and maintaining healthy skin biopsies are vital diagnostic tools. They help confirm or rule out malignancy. While there are risks of bleeding and infection, the benefits of accurate diagnosis and timely treatment outweigh these risks. With proper technique and post-biopsy care, complications are rare and manageable.